Ladies and gentlemen, dear colleagues, thank you for your attention and thank you for attending this conference. Before we go to this expanded presentation, I would like again to thank our wonderful, enthusiastic organizers who enabled this meeting to happen, put tremendous energy in setting up a virtual meeting despite pandemics and organizational constraints. I'm very happy to share with you today our latest results and to raise a question. Are we looking for wrong culprit in Lyme disease testing? Before we go in, I have to present you my financial disclosure as I'm an employee, Chief Scientific Officer, and lab responsible of Red Laboratories Belgium. We have three major learning outcomes for this lecture: to describe the overall high expansion of undiagnosed Lyme disease cases worldwide and the possible link to screening only for Borrelia burgdorferi sensulato and rarely testing for Borrelia miyamotoi, to identify the utilization of phage-based testing and bacterial presence as related to the testing choices and late chronic stage patients, and finally to discuss how the overall high failure rate of tick-borne infections related testing underscores the necessity for novel approaches. The goal of this contribution are to bring the focus on the importance to enlarge borreliosis-related testing targets by not testing only for Borrelia burgdorferi sensulato, to present the importance of novel testing approaches, and to emphasize the importance of testing the ticks and shed some light on high prevalence of Borrelia miyamotoi presence both in ticks and late-stage undiagnosed patients. Tick-borne diseases, which afflicts human and other animals, are caused by infectious agents transmitted by tick bites. Tick-borne illnesses are caused by infection with a variety of pathogens. Because individual ticks can harbor more than one disease-causing agent, patients can be infected with more than one pathogen at the same time, compounding the difficulty in diagnosis and treatment. Tick-borne infections are increasing globally. Lyme disease is among the most prevalent vector-borne infection in the US and Europe and is reaching epidemic levels. Thus, whenever possible, get a tick tested. When you are back from the walk from the excursions, inspect yourself. Check for the tick presence. If you spot a tick, remove it properly and get it tested. A little tick can cause a big problem if not addressed properly. It can cause immune dysregulation, gut dysbiosis, and end up in chronic illness. Tick-borne diseases are very complex, and it is important to bear in mind that tick-borne diseases can be acute or late-stage persistent chronic. And this is important given that diagnostic and the treatment approaches might be different in these two situations. Lyme disease exhibits a variety of symptoms that might be confused with immune and inflammatory disorders. If an individual has any chronic health condition, ranging from arthritis to chronic fatigue syndrome to fibromyalgia, etc., it is very important to rule out or diagnose tick-borne diseases. It is apparent that many cases of fibromyalgia and chronic fatigue syndrome are actually tick-borne disease in disguise. Chronic patients have a complex clinical picture with multiple afflictions needing this multiple testing and careful interpretation of testing results. Novel testing approaches are needed, and one of those is phage-based tests. The overall high failure rate of tick-borne infections testing underscore the necessity for novel approaches, which means not relying on serology and two-tier testing, which is the norm today. Phoenix phage Borrelia detection method consists of targeting the presence of outnumbered prophages as part of the bacteria lysogenic cycle. Indeed, there are two parts of the cycle, lysogenic and lytic. In the lysogenic cycle, the phage infects a bacterium and inserts its DNA into the bacterial chromosome, allowing the phage DNA, now called prophage, to be copied and pass along with the cell's own DNA. The other cycle is a lytic cycle, which is much more known, where the phage infects a bacterium, hijacks the bacterium to make a lot of phages, and then kills the cell by making it exode by lysis. Bacteriophages are present only on active bacterial infections. Hence, a phage-based test is a direct proof of an active infection, which is completely different from serology testing that only can assess the exposure. For this research, we used ticks as a main searching material. We wanted to analyze different ticks, those that were sent by patients who removed them from themselves or from their pets, and those sent by veterinary doctors. The obtained ticks were mechanically graded with glass beads, and DNA was extracted by phenylchloroform method. Then the extracted DNA was analyzed by two methods: HybriSpot tick-borne bacterial flow chip, which enables simultaneous detection of 7 tick-borne bacteria genera, very well known: Rickettsia, Ehrlichia, Anaplasma, Francisella, Bertonella, Borrelia, and Coxiella. This method is based on PCRs, followed by dot plot, where the PCR products are hybridized on the membrane, where every target is spotted twice on different locations. The second methods we use to analyze the tick are Felix phage Borrelia test, which enable to focus on Borrelia presence with different Borrelia strains. Bacteriophages could become a diagnostic tool based on the principle that if there are phages, it is because there are living bacteria. There is no phages if there is no bacteria. It's a kind of symbiosis. Felix Charity, together with Leicester University Microbiology Department, have recently developed a Borrelia phage-based PCR test searching for 3 major Borrelia groups: Borrelia burgdorferi sensulata, Borrelia miyamotoi, and relapsing fever group. This method is efficiently used to assess both human samples and ticks. It's highly sensitive and specific, do not generate positive signal against other bacterial strains, and false positives are ruled out by sequencing. The test starts with, of course, a biological material, which could be blood, if it is a human sample, urine, cerebrospinal fluid, or a tick, which was the case in this study. The DNA is then extracted from a biological sample by manual DNA phenylchloroform extraction method. This step is extremely important because it's the only extraction method that enables us to have a good quality and quantity of phage DNA. Other extracting methods using beads or columns were tested and showed not equal quality of extracted material. That's why we focused on manual DNA extraction with phenylchloroform method. The extracted DNA is then analyzed by real-time PCRs. 3 PCRs are performed, one searching for Borrelia burgdorferi sensulata, one for miyamotoi, and one from relapsing fever group. The positive-like samples generate the well-known curves, and those samples are recovered and sent for confirmatory sequencing in order to rule out false positive results. How it looks like: every single DNA is analyzed for each target in quadruplicate. 4 replicates from each DNA is analyzed for a given target: Borrelia burgdorferi sensulata, relapsing fever, and Borrelia miyamotoi. When a positive signal is obtained, we have these nicely raising curves. This is the signal, there is an amplification, and these samples are then sent for confirmatory sequencing. The ticks we received have been submitted to DNA extraction, and their DNA analyzed, as I said, by these 2 methods, HybriSpot and Felix phage. The results we obtained are very interesting. 40% of analyzed ticks were negative, all 40%, which means that 60% of analyzed ticks were positive for at least one pathogen. HBsPut enabled us to see that other pathogens are not present in those ticks, like Rickettsia was not detected, Ehrlichia was not detected, Anaplasma, Francisella, and Bartonella were not detected, while 20% of analyzed ticks were positive for Borrelia burgdorferi, because this test enabled the detection of Borrelia burgdorferi sensulato group, and Coxiella was not detected. The same DNA was then used in Felix phage Borrelia tests. And pathogens found in positive ticks are as follows. Borrelia burgdorferi was present in 70% of positive ticks. But Borrelia miyamotoi was present in 60% of positive ticks, while Borrelia relapsing fever group was present in 23% of positive ticks. We were very much surprised when we saw this result. Furthermore, 25% of positive ticks were for two pathogens at the same time. Of course, when we see these results, we see, of course, that Borrelia burgdorferi sensulato is more or less equally detected by two different methods, but it's only detected in 20% of analyzed ticks, while 60% bear Borrelia miyamotoi and 23% relapsing fever group. This was pretty interesting and raised a lot of questions. As I said, 60% of analyzed ticks were positive for at least one pathogen. Among them, only 70% were positive for Borrelia burgdorferi sensulato, which is the main investigation target in Lyme disease. Among positive ticks, 60% were for Borrelia miyamotoi, while this pathogen is not commonly searched when a patient wants to test for Lyme disease. Furthermore, and very interesting, this result is in line with those obtained on human samples. Since 1 year, over 2,000 results from patients originating from various countries have been obtained. And testing included mainly late stage or chronic patients, and the aggregated data are showing 30% of negative results and 70% positive, among which over 60% indicated the presence of specific Borrelia miyamotoi phages, the same data as we obtained in ticks. If you want to hear more about clinical data, please see the lecture from Dr. Louis Thuyer that is following this one. Back to the data we obtained with ticks. With respect to those results, a logical question raised. Are we searching for wrong culprit by testing only for Borrelia burgdorferi sensulato? When you look at those results, you can really raise this question. If you consider now the most used diagnostic methods, we'll see that they are focused mainly on Borrelia burgdorferi. Of course, the most widely used testing is antibody-based ELISA immunoblot, but those tests give only indirect evidence of the exposure. They're characterized by low sensitivity, cannot distinguish between active and non-active Borrelia presence, and of course, they present some difficulties in identifying Borrelia subtypes. I have tests for Borrelia burgdorferi sensulato, and that's it. Presence of bacterial DNA by conventional PCR, 16S PCR, indeed bring the direct evidence of Borrelia presence, but it's very low sensitive, with a very low sensitivity for patients in late stages. It is good for early stages, but not for late stages. And of course, cannot distinguish live and dead Borrelia, and might be able to tell different Borrelia subtypes if the test is designed like that. But most of in vitro diagnostic PCR tests, qPCR tests, are designed again to focus only on Borrelia burgdorferi sensulato and we can miss a lot of other strains that might be present both in ticks and in human cells. Yet another test, LTT test, provide also indirect evidence. It's characterized by variable sensitivity and also cannot identify different subtypes in the same test. You can undergo multiple testing. That's why phage test is a very interesting new approach. It brings direct evidence of Borrelia presence. As I said at the beginning, you can have phages if you have a living bacteria. Without living bacteria, there will be no phages. This test presents high sensitivity and specificity and can uncover in the same test different Borrelia strains, miyamotoi, relapsing fever, and burgdorferi sensuato. And since that you have phages only if there are living bacteria, it means that you have an ongoing disease. And this precisely can help physicians distinguishing between post-Lyme syndrome, chronic infection, and actively ongoing infection. This is a very interesting point because there is a lot of debate around chronic patients and also post-Lyme syndrome. Since this high prevalence of Borrelia miyamotoi in tested ticks, further supported by similar percentage found in tested patients, one can hypothesize that the high failure rate of current two-tiered screening testing comprising ELISA and F-positive immunoblood, as you know, which is searching only for Borrelia burgdorferi sensuato, this may be due to the wrong testing target. In other words, the overall high expansion of undiagnosed Lyme disease cases worldwide might be linked to the screening choice, focusing only on Borrelia burgdorferi sensuato and only rarely testing for Borrelia miyamotoi, while the later one seems to be much more prevalent, as we can see both from tick study and from aggregated patients' data. Further accumulation of the data, both from the patients and ticks, should bring the answer to the question I asked at the beginning. Are we searching for a wrong culprit? Searching for actual bacterial presence using phage-based testing might also pacify the debate and controversies on testing choices and late and chronic stage patients. Here we'll find some selected readings to further support the background of this communication. I would like to end this communication by expressing our gratitude towards the patients and veterinary doctors who send the ticks, practitioners who send the samples for testing, laboratory staff, Felix Charity, University of Leicester Microbiology Lab team with Professor Marta Clocchi and Jean Yushan. And of course, thank you for your interest and your presence today. Thank you.